Hi, welcome to my presentation. My name is Jackie Nassi, and I will be presenting today on Alyssa Hamasaki, or AM for short. So who is the patient? Her name is Alyssa Hamasaki. She is 25 years old. She is a female who is single, and her race ethnicity is Asian/Japanese. Client is presenting with issues concerning excessive fatigue, increased muscle soreness, impaired concentration, and excessive, often uncontrollable worry, which has been impacting her at work, social settings, and in her personal life. These concerns have started to really impact her life for the last year and a half once she moved into her own apartment, but has been present to some degree since she was a child. Some background about her. She enjoys going for walks and exercising, has some friends in work as well as outside of work that she enjoys spending time with as well. She is involved in the religious community and is close to her own family. She likes to volunteer through her church and has developed a good friend group at her gym as well. It's one of those like CrossFit gyms that she really enjoys. As for family history, there is no diagnosed family history of mental illness. The client reports she has had her suspicions about her family members, but mental health is not a topic that is very easily discussed in her family. Her mother seemed to exhibit signs of high stress and excessive worry in the household growing up. Her living environment is just her living in a one-bedroom apartment with her dog. She considers her environment to be clean, but can be disorganized at times when she's experiencing those high stress moments. Client typically does work 8 to 5 p.m. She works out, takes her dog on a long walk, and then prepares herself some dinner. She often finds herself very tired at the end of the day, so she doesn't have a lot of time for social events or things like that. But every now and again, she'll squeeze a friend in and meet up with them during the week or on the weekend. As per her education, she has received her MBA at the age of 24 and has had one job since graduation. She has felt burnt out from her job, feeling a bit underappreciated while simultaneously feeling nervous that at any point she could be fired. Client has had no history of legal issues. Her client considers herself a casual social drinker, but she is relying on substances such as alcohol and marijuana increasingly as her anxiety increases. Um, Client has been hospitalized several times before after feeling convinced she was experiencing a heart attack. Doctors confirm that there has never been a heart attack. But rather they believe she is having a panic attack, and that is where she received her referral to see a therapist. During these episodes, she experienced symptoms such as chest pain, chills, sweating, palpitations, fear of losing control, and fear of dying. So our diagnosis ends up being primary diagnosis was generalized anxiety disorder because of these symptoms, as well as a secondary diagnosis of panic disorder. Our assessment measures would include generalized anxiety disorder, 7-item scale, the patient health questionnaire, 9-item scale, 9-item scale, the panic disorder severity scale, a physical examination, which includes blood work and an EKG, and a structured clinical interview for DSM disorders. As per our treatment approach, it would be cognitive behavioral therapy and acceptance and commitment therapy. Goal one and objectives for our treatment would be that the client will decrease maladaptive and catastrophizing thoughts. So, objective one will be that client will identify when she's beginning to experience physical symptoms of thoughts that are maladaptive or catastrophizing, and she will challenge these thoughts 75% of the time for 6 weeks with a 2-month objective. As per objective two, client will practice utilizing coping skills such as diaphragmatic breathing when experiencing early signs of panic attacks, 75% of the time for 6 weeks with a 2-month objective as well. Okay. As for goal two will increase present moment awareness and acceptance of experiences without trying to change or avoid them. Objective 1 says client will utilize mindfulness practices to ground herself in the present moment 75% of the time. She begins to feel uncontrollable worry for 6 weeks, 2-month objective. And of course, uncontrollable worry will be discussed what that feels like with the client. And then objective 2, client will practice observing the worry about having a panic attack and will utilize cognitive diffusion 50% of the time to create a distance from her thoughts and who she is as a person for 6 weeks with a 2-month objective. As for our interventions and methods, counselor will utilize mindfulness techniques to bring client to the present moment, teach and promote cognitive diffusion, teach and practice meditation to increase awareness of thoughts, utilize creative hopelessness to facilitate client letting go of old coping strategies and embracing new ones introduced in therapy. Counselor will teach diaphragmatic breathing, Socratic questioning and reality testing to challenge thoughts. Will assign homework to assist with application of newly developed skills. And will utilize role plays to help the client practice skills within the session. As for the level of treatment plan, we're going to utilize an outpatient community care to be the least restrictive approach. We're going to do individual counseling 2 times a week for the first month, and then we're going to downgrade it to 1 time a week for 5 months with the addition of group counseling bi-weekly to increase that community support as well for her. In terms of support services, we're recommending some group counseling as well as some local yoga or mindfulness practice to really engage how she loves to exercise and like work in those strengths, as well as including the mindfulness meditation practice as well. And we also noted community service groups, as gratitude is often a very good practice utilized to help treat anxiety as well. And these are my references. Thank you guys so much for listening to my presentation, and I hope you guys have a great night. Bye now.